Want to make a podcast? Spotify's got a platform that lets you make one super easily and then distribute it everywhere and even earn money, all in one place for free. It's called Spotify for Podcasters. Here's how it works. Spotify for Podcasters lets you record and edit podcasts right away from your phone or computer, so no matter what your setup is like, you can start creating today. Then you can distribute your podcast to Spotify, but also everywhere else podcasts are heard. Video podcasts are also available, and you can earn money in a variety of ways, including ads and podcast subscriptions. Did I mention it is totally free, no catch? I've been using Spotify for Podcasters since the very beginning of my show, and now we're nearing our 200th episode. So I can definitely say it's an easy platform, and I've really loved using it. So be sure to download the Spotify for Podcasters app or go to www.spotify.com/podcasters to get started. The Dental Download Podcast is your source for insight into dental school, conversations with dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Haley Schultz. Let's get into this week's episode. Hello, everyone. Happy Monday. Welcome back to another episode of the Dental Download Podcast. This week is going to be a solo episode, just me, and the theme is why dentistry? So answering that question mostly for myself, giving you an outlook into why I chose dentistry. That could be helpful if you're writing your personal statement, if you're still trying to figure out if dental school is for you, or if you're just kind of curious to learn more about me and myself. So I did also get a couple submissions from other dentists and dental students about why they chose dentistry that could also be helpful for all of those things I just mentioned. But before we get into the main episode, I did just want to do a quick recap what's been going on. So I just am finishing up my break when I'm recording this. The Monday that you're listening, the 12th, is the first day back from our 1-week break. So we have a lot of stuff going on with the D1s lately because all of our clubs are kind of pitching to them, letting them know what we're about. So there's always a lot of Zooms and different events going on. I have a bit of stuff to do for as the District 6 as the editor and communications director, as well as the design specialist. So getting things together for Instagram and getting different event promotions going. And also we have to write a newsletter. So lots of things going on with that, and just kind of getting the rest of our classes, like I've talked about the past couple episodes. We're picking up with some new classes that'll go through the rest of the semester, and our finals end on August 16th. And then I'm also going to be in Alaska actually at that time. So right when finals are ending, I'm taking a family trip to Alaska, like my parents and I and my sister. So that's going to be a really great way to spend about 10 days of our 2 weeks that we get off before fall semester starts. And yeah, not too much other updates. I thought that was something exciting to share with you all, even though it's about a month away from the time that you're listening to this. And I do have some more assisting, and I have another rotation coming up this week for oral medicine. So once that happens, I can talk more about it in next week's intro. But let's just get into the main episode. All right, so for this episode about why dentistry, I'm going to spend most of the time talking about some of my own reasons. But first, I wanted to give you a quick about me if you are new to the podcast or don't know much about me as an actual person besides being the host of this podcast. So I'm a second-year dental student at University of Michigan, and I have episodes all about applying to dental school in the DAT and what I did each year of undergrad. Those are all pretty earlier in the series of this podcast. You can check those out if you're interested. But I've always known I wanted to be a general dentist. That's like where my main interest is. I would be surprised if I changed my opinion on wanting to specialize. But so far, I want to be a general dentist. And I'm considering doing a 1-year residency upon graduation, most likely an AEGD and not a GPR, but that could change. And I do have interest in practice ownership. And now I wanted to share a few answers about why dentistry that some of my friends and dental students sent in to me, and then we'll get into more expanding on my own reasons that could help you figure out what you want to do when it comes to dentistry, or help you figure out if dentistry is even the right thing for you. So one of my fellow dental students said that they chose dentistry, or one of the things they love about dentistry is the immediate effect that a dentistry can have to benefit patients. A patient can come into the clinic with a broken tooth and leave the clinic the same day with that tooth restored. Some other people said, I love how operative the field is. I just really love how many hands-on solutions there are. A dentist said the workplace environment is calm and productive. That's a positive, someone actually working. And then the other two people that submitted are dental students. One person said, oral health is the gateway to optimum systemic health. I know I'm making a bigger impact. And that's definitely a big thing that I touched on a little bit in my own personal statement, actually, is that oral health is just one facet of a whole person, but it has such a big impact on their overall health. So patient education and making people understand that and understand why dentistry is important, since it's not a part of your medical insurance, making people understand why they need dentistry and preventative care, why that's so important. And that's a big part of why dentistry for me as well. And the last person said, you get to unleash some of people's hidden beautiful smiles and confidence. That's a big thing I feel like I read in personal statements that I'm critiquing, is a lot about restoring people's confidence, restoring people's ability to function even. If you have really terrible occlusion, eating can be very painful, talking can be very painful, or if you got in an accident and your teeth got all messed up, or if you were just born with very poor teeth or you didn't have the means to take care of them and you're someone that's maybe 60 years old and is losing all your teeth, that same situation, a lot of those people can have such a big impact by dental procedures, really changing the way that they can even function day to day. With all that being said, though, I did just want to give a little preface for some of my general why dentistry reasons, and then I'll kind of expand on each of those topics for a little bit here. So one of the biggest things for me about dentistry is flexibility. And I'm not touching on exactly the same things that I did a YouTube video about, actually, which is titled Why Dentistry. So there'll be a few different points here and probably a few different points there, because I made that video right before starting dental school. But if you're curious about that, and also I do read some of my personal statement in that video, so you can check that out. Just search Haley Schultz, Why Dentistry, and that will lead you to that video. But today, some of the things, like I said, flexibility is a huge thing, but that can stem into all areas of your life and then within the actual dentistry itself. So I'm not just talking about flexibility in the profession, also flexibility in your own personal life. And if you ever want to be doing something new, you can take courses to learn a new skill and kind of implement that into your practice. You can do really basic things and just have like a repetitiveness, keep it simple, making work easy, less stressful. Anything that's complex, you can refer it out. Or if you feel like that's a little non-exciting, not stimulating, you can take on complex cases that you feel comfortable performing. You can take more courses to feel more competent in those complex cases. And you're able to do a lot of specialty procedures as a general dentist. So you can do basic endo, you can do cosmetic dentistry, simple orthodontics, if those things interest you. And there's always advancing technology. So you're able to really bring in new things to your practice as often as you see fit financially and you see a need for your patients. Basically, there's always something new to learn and always a new way that you can kind of elevate your own skills, elevate the care that you're able to provide your patients. Or you can keep it on the flip side and just keep things really, really simple and stick to the basics. But kind of expanding on flexibility and balance is the first theme I wanted to talk about for why dentistry for myself. So when it comes to career changes and different ways you can be making your income, you can be an associate or you can be an owner. And even within being an owner or associate, there's different levels. So you can be kind of a non-traditional owner. So you can be someone that's absent. They're called absentee owners. So you're someone that might own 3, 4, 10 dental practices and not actually practice at any of them. You're more of the business side and you're kind of supervising manager of this brand, basically, of these practices. Or you can be someone that works as a practice owner but has associates working for them, so they have more time to take time off and do other things that can make them money in different ways, or different things that they're passionate about, like being a speaker, like being an author, like leading CE courses, which is continuing education. So you can be doing that, or you can work in as associate forever. If you don't want the responsibility of owning any form of one or many practices, you can work as an associate, which means you're working for another dentist at their practice, but you're still the one person providing the care to patients. And then there's the question, when you're an associate, are you working at one practice full-time, or are you working part-time at multiple practices, maybe 3 days a week here, 2 days a week here, or you work 5 days a week somewhere, but you do like Saturdays for a different office and kind of fill in. And then when it's speaking of ownership again, are you going to buy into a practice? Are you going to start up a practice? So there's a lot of flexibility just in the aspect of associate versus owner, and then how you want to take those different levels. And for a lot of people, they do a little bit of everything. They start out maybe as an associate, they get into ownership, then they might buy a second practice, maybe then sell that other practice, and it's kind of a cyclical thing. But another thing I want to talk about, like I said, flexibility, balance, it's in the career, but it's also kind of into your own personal life and your own personal finances. So having income is one thing, obviously earned through your job, but if you do decide to own a practice, you get that added benefit of that being an asset that you have that you can sell later on, especially if it's a practice that you're keeping up with and you have the generally recent technology, you have a good patient base, you have good collections going on, then you're really able to sell that practice for a lot of money. From what I'm hearing on podcasts, like upwards of $1 million for most successful dental practices, which blew my mind at first, but I guess it does make sense. And then you obviously can sell a practice for even more if you own the space that you're working out of and you're not just renting. But even if you are just leasing an office space, you still can sell your practice for the fact of like your name and your patient base, your supplies. Those things can be sold if you do decide to retire or if you wanted to maybe move or something. It's not that common, I don't think, for dentists to like move across the country once they've already started up or bought a practice, but it does happen. Things happen in life, and it's definitely an option if need be. So the next thing that I wanted to touch on when it comes to one of my reasons that I thought dentistry was very exciting and the career and profession that I wanted to have is that the actual work is very enjoyable yet still challenging. So every single patient is different, and you're going to have really advanced treatment planning skills. Like I mentioned before, you get to choose for the most part which patients you're seeing, which cases you're going to treat in office versus refer out. But even a simple filling is going to be slightly different for every single patient if you choose just to really do the basics or something, because they have a different medical history. They're going to be like different shade matching even. They're going to have a different natural shape to their tooth. They might have different occlusion. They might have different goals as, like I said, a patient and their overall treatment planning from A to Z, everything they want to get done over the next maybe 3-4 years if they have a complex dental care needs. And then the other thing is that you get direct results very quickly. That's something I think someone mentioned when I was reading off other people's reasons, but that's something a lot of people like about dentistry is you don't have to necessarily start up a project and you don't see it come to fruition for years and years. And that's something that happens in certain other professions. But for this, generally speaking, the longest thing you're doing is maybe orthodontics or maybe doing a full denture, because that's like 7 or 8 appointments. But even then, it's not going to take that long. Like implant cases, maybe 6, 8, 9 months, but that's something again that you're still doing multiple appointments, and each appointment at least you're accomplishing the one little step of the puzzle. So I just really like that you get direct results, and if you can't fix it, someone can. So there is always someone else you can refer out to, again, just speaking as a general dentist. And there's always more you can learn. I touched on that earlier as well. That's something that appeals to me. And it's nice that if you feel like you've really perfected one type of specialty procedure as a general dentist, let's say you took a lot of CE on endodontics and you feel like you're doing that really well and you'd like to learn a little bit more about restoring or even placing implants. Then maybe you're 45 years old, you're going to start getting really into implants. That's an option. If you feel like you're bored, you don't need to be bored, is basically the answer. You don't have to like jump between professions or jump between companies, because you're able to change things up and stimulate things for yourself just by adding in something new and learning something new, especially because dentistry is always changing as is. But even the current things that exist, it's nearly impossible to know and be great at everything. So there's always something new to pick up once you kind of hone in your skills on one thing at a time. This is something that's huge for me and huge for a lot of people, is the connections with patients. Something I definitely highlighted in my personal statement, something I always mention to people, that your physician perhaps sees you once a year for a physical, maybe. A lot of adults, maybe every few years. They just don't end up going to the doctor as much as they should. But if you have dental insurance, you go see your dentist every 6 months for a cleaning and you get that checkup there. So you're seeing and interacting with these patients much more frequently than other types of healthcare professionals. And even thinking anyone besides like a family medicine physician who's doing those annual or every 2-year physicals, other doctors see a patient, address their specific thing. Like if they are a cardiologist or if they are a GI doctor, they'll see you till you feel better, and then they might not ever see you literally again in your lifetime. But with dentists, likely you're going to live in the same area once you kind of settle down, and you're going to be seeing the same dentist for years and years. Your kids might go see them. They might know your own parents, so like grandparents, you, and then the kids. It's just a really cool dynamic and gives you a lot of opportunities to make really strong connections with your community that you're practicing in or that you're living in. And that's something that's really important to me, and something I touched on a lot in that YouTube video that I mentioned is just that I will have the opportunity to be very involved in my community by seeing people in both my work and my personal life, and just getting to really form relationships with people, gaining people's trust, doing good for the community that I'm in, whether that's, again, in my personal life, volunteering, going to kids' activities, or whether that is through my actual day-to-day job as a dentist. So that's something that is very important to me and something that I look forward to doing through dentistry. The last thing is something more specific to me, I think, and a lot of people, but not everyone. Not everyone likes kids, but I definitely really like kids, and I love that as a general dentist, you have the opportunity to see children. There is a dental specialty, pediatric dentistry, but general dentists can see kids as well, again, as long as they see fit, as long as it's not too complex. They're able to do their cleanings, basic fillings, as long as they're cooperative and everything. So I'm looking forward to the opportunity to working with some children in my general dentistry practice. The last thing that I kind of touched on already in some form is community. And so this way, when I'm talking about dentistry, I don't mean the community that you live in, that your practice is in. I'm actually talking about the amazing community of dentistry. So there are so many great people involved in dentistry that I've known just as a pre-dental student, trying to get into dental school, trying to get my foot in the door with this profession. Now that I'm in dental school and I'm doing this podcast and I'm just going through general clubs in dental school, eventually getting to go to a lot of in-person conferences and stuff this coming year, hopefully, I'm going to have the opportunity to meet even more dentists and people in the profession. And just in general, the vibe that I've gotten from pretty much everyone I've met in dentistry, they're learners, they're supportive, and they're always looking to help each other, and they're always looking to improve each other. They're definitely people that are very driven, they're very ambitious, but they want everyone to be successful. I haven't seen dentistry as being a competitive field. I feel like even if you're two general dentists in the same community, you're still supportive because you understand that not everyone is each person's cup of tea, and you're going to appeal to who you're going to appeal to regardless of what the person down the street is doing. So I've definitely seen that there are just so many great people in dentistry. But along with that, I feel like there's always more and more opportunities to make connections and to get involved in the community of dentistry. Now, with organized dentistry, of course, that's always been around for a long time, like the ADA, and then your local state dental association, and then probably your city or township might have one. But then there's also Facebook groups more with the modern times, like Dental Nachos, or like our podcast has a Facebook group, Dental Download Podcast Facebook group, or just general websites. So there's blogs, there's forums, there's Instagram, there's YouTubers that are dentists now. And then another thing that's great for really specific, I guess, actual dentist community things is learning more about dentistry, learning more clinical skills. That's really great to do at those conferences, like I was saying, for the ADA or for Cosmetic Dental Association or things like that exist. But there's also study clubs that can be in person or online. So one that I know of that's great is the New Dentist Study Club, I believe is what it's called. I had a dentist on here probably a few episodes ago that founded that, and that is a virtual one, and most of them live on the West Coast though, so it did not really work for my time zone, but I would have loved to be involved. But it's New Dentist Business Study Club, I believe is what it's called. So they work on learning more about business and learning more about having really successful dental practices. Specifically, a lot of them are doing startups, but if you're not looking for business, there's a lot of clinical ones where they go over different up and coming research or learning different dental technology or dental skills, because it's really important to keep up with dentistry and actually required to do CE as a dentist. So there are a lot of great places that you can get involved, whether it's kind of a large scale group or if you want to form one, like I said, with people just in your township that your practice is in. That's an option that's happening, and that just proves how dentistry is so community-based, and I think that's something that makes it very exciting to get involved in. There may be tons and tons of dentists as you're driving through a town, but that's a great thing, and they're a really welcoming bunch from what I've noticed. So all of this is definitely exciting, no doubt there, but I do want to be fully transparent and say that when I started dental school and versus now, I definitely have a different opinion about things a little bit. Not in the sense that I regret choosing dentistry or anything of the sort, but just that the options that I say, wow, the flexibility of dentistry is so exciting, great reason to choose the profession. It is, but again, I want to be transparent in saying that the amount of options that there are for general dentists used to excite me, but now that I'm in the middle of dental school, it actually kind of overwhelms me more so, and I know this is something that's going to figure itself out over time, but it is something to think about when it comes to entering a profession that, like I said, has so many different avenues and can be kind of unpredictable at times. It does stress me out a little because it's not as cookie cutter of a path as I've had in many other aspects of my life so far. And there's so many options, like nearing the halfway point in dental school, I do feel kind of pressured and a little bit overwhelmed to know what my maybe like 5-year after graduation professional timeline is going to look like exactly if and when I'll buy or start a practice, if I'm going to do a residency, where is that going to be, where am I going to open this practice, who do I need to be meeting if I'm trying to get a mentor and buy their practice. So you do feel that pressure, but I think that's natural, and I think in general that's a positive thing as much as it does feel stressful at times. It's good that so many of us feel that way and care enough to be worried about it, I guess, and care enough to want to be successful. But that is something to keep in mind, that the flexibility is great, but it's not so cut and dry as maybe medicine, where once you choose your specialty, that's what you're going to be doing the rest of your life, and you go from there. With dental, if you're doing general dentistry, it is so wide open, and that's great, but it also can be a little stressful. So I didn't want to end on a negative note, but I do just want to say that dentistry is an amazing profession from everything that I've gathered so far just in my few years being in dental school, but I'm really looking forward to the future and hopefully figuring out all those questions that I just mentioned a little bit ago. And I hope that anyone listening, this kind of cleared things up for you, or maybe gave you a new idea of something you could mention in your personal statement, or something new you didn't think about maybe exploring as a dentist or doing with some of your free time. So with all that being said, I want to thank you all again for listening to this week's episode. Next week, we're going to be joined with a guest again. So that is going to be one of my friends that I've met through social media, Joe. He is a D2 at Ohio State University, and we talk all about his involvement kind of in dental school now. He's super involved in their ASDA chapter. We talk about getting into dental school as a first-generation college student, his own experiences. He's also done a really good job of securing some scholarships through smaller organizations, so we talk a little bit about that. And we just kind of go back and forth. Whenever I have dental students on, I feel like it's a nice episode. We just kind of banter, kind of comparing our dental school experiences, the good and the bad. So I hope you're all looking forward to that episode. And with all that being said, I will talk to you next Monday.